Hi there, and welcome to the OMT training PowerPoint on hypertension. Now, I'm going to ask you a serious question. Are you taking blood pressure readings with all of your new patients? If you're not, why aren't you? I, as a clinician, advise all of my students that on all new patients, they should do blood pressure testing. Get it in as a standard part of your new patient pro forma. It gives you a really good indication of that person's underlying health. And if you're seeing patients for a long period of time, maybe years even, you can monitor it every 6 to 12 months. You, as a primary healthcare professional, are probably going to pick up someone's hypertension or increased blood pressure faster than the medics will do, because you may be seeing these patients on a more regular basis. Especially in the UK, it's very challenging to get appointments with general practitioners these days. It can be very hard. But, as a primary healthcare professional, as an osteopath, physio, chiro, or manual therapist, massage therapist, you have a duty of care to your patients. The reason why it's so important is because 1 in 4 men in the UK especially have hypertension, and they will be unaware of it. Undiagnosed high blood pressure is a silent killer. It may have no signs and symptoms whatsoever. That's why it's so important that we screen our patients. 1 in 5 women may also have hypertension. And if you think about how many patients you're seeing on a daily basis, that is a seriously big percentage of patients that you might be treating that have high blood pressure that are unaware. Now, undiagnosed high blood pressure is also a significant red flag for quite a lot of manual therapy techniques that we do. So let's be fair, if we can screen our patients as part of our new patient case history, do some blood pressure testing, you might be able to pick up someone's high blood pressure before it becomes a significant problem. With some education, nutritional advice, possible referral, you are going to be able to have a significant impact on that person's long-term systemic health. It's important that we think about this, and it's important we start adding it into our clinical practice. Hypertension is a problem. 1 billion hypertensives worldwide with a global burden of 4.5%. It's massive. In the UK and the US, we're not the healthiest of countries. 25% of all adults are hypertensive. That is crazy. Considering it's a silent killer, 25% of all adults in the UK are potentially walking around with an issue that can give them some long-term health problems, and they're not even aware of it. 12% of all consultations in primary care are due to hypertension. It is a problem. It will lead to having significant cardiovascular health issues. So this is why we think, look, it's important that we start screening these patients as soon as possible. If we look at the UK epidemiology, again, I think a lot of it's down to age, lifestyle factors, nutrition. But as we said, 25% of the adult population have hypertension. Now, 50% of those over 60 years of age have hypertension. With an aging population, the prevalence of hypertension and the requirement for treatment will continue to increase. Now, I ask you again, if you're not taking blood pressure with all of your new patients, why not? It's a big global problem, especially in the Western world. We have to think about what is going on, how we can help. And if I have a patient that comes in and we test their blood pressure and it is high, then I've got a great window of opportunity to say to them, listen, this is the problem. This is what we're looking at. Let's manage this and let's see what we can do through education, nutritional advice, exercise, diet. If we don't deal with people's uncontrolled hypertension, they are going to run the risk of premature death. There's no point in sugarcoating it. You increase the risk of heart attack, stroke, kidney failure, blindness, and a whole host of other complications. So you can see how serious it is if left untested. So the importance of hypertension. High blood pressure is a global problem. It is an issue with the elderly and aging populations, and if untreated, will cause significant cardiovascular issues. The predominance of hypertension is all to do with reduction in arterial supply, narrowing of arteries. If arteries that carry blood to your heart get damaged or clogged, this is going to lead to heart attacks and other issues. So there's different stages of hypertension. Stage 1, stage 2, and stage 3. Now, we've put some information in the subsequent PDFs for you to have a little look at in more detail. Nice guidelines from 2019 look at optimal blood pressure ranges, okay? Normal, sort of 120 over 80. Now, although these are changing a little bit because as we're sort of progressing, blood pressure is sort of rising a little bit. But obviously, we look at normal, high normal, grade 1, 2, and 3, and then significant issues with hypertension at the very high end. So I say to my patients, look, let's not worry about it. Let's not get too concerned. Let's measure the blood pressure. Let's see where we are. If it's on that higher end, we can monitor. If it's significantly high, then we're thinking about let's refer to a medical practitioner, get them into that process so that we, can see whether they need to have any form of medication or if we can deal with it dietary wise. But that's why it's really important you have a good relationship with your local doctors and GPs, writing the referral letters and getting them to have a look at your patients if you're picking up things. There are many, many causes of hypertension. You can have issues with lifestyle factors, drinking too much, excessive drinking, smoking, being overweight, not doing enough alcohol, dietary issues. So as your patient is walking into your treatment room, you're judging. We judge our patients, not in a negative way, but as they walk through the treatment room, I'm looking at that patient. I'm almost doing like an observation cardiovascular screening tool. If they're coming in and they appear to be overweight, out of breath, and I'm not talking to just run for the treatment, if they look unwell, if they look unfit, then these are all going to be sort of little ringing bells in the back of my mind thinking, are they predisposed to this? Part of my questioning alongside blood pressure testing, cardiovascular screening is going to be, what's your family history like? Do you have a family history of these issues? We can have secondary hypertension, which can be caused due to sort of hormonal issues. And again, we'd be referring patients back to their general practitioner who would probably be monitoring that anyway. We're more concerned probably with the stage 1 aspect of primary hypertension, which is the most prominent or prevalent that we're looking at. This is quite a nice visual image to do with untreated hypertension. You can see the normal heart wall thickness, and on the right, you can see a thickened heart wall due to significant atherosclerotic changes, plaque and artery buildup. You can see how hard the heart is going to be working to try and get blood around the body. Now, the issue here is that patients may be having these problems and they may be completely unaware of it. That is that's a concern for me. That's what I say to my patients. It is a silent killer. That's why I do blood pressure testing as part of my new patient screening at all times. Now, diagnosis and referral is really important. Look, I don't tend to diagnose in clinical practice. I don't turn around to my patients and say, you definitely have this, because to be honest, I'm not sure and I wouldn't put my mortgage on it. So for me, what I say to my patients is, look, we're going to do a blood pressure test. We're going to look at where you are. We're going to do it over several times. We're going to monitor it down. If it's a bit high, I'm going to turn around and say, look, I'm going to write you a letter, go to your GP. It may literally just be you've been rushing for the appointment, et cetera, and then we can get it tested. But if they are presenting with significantly high blood pressure, we're looking at 140 over 90. Again, we repeat the test along the blood pressure guidelines, but think about referring that person. I always say to my patients, look, I'd rather be wrong. I'd rather refer you to the GP and be wrong than not refer you. And actually, there's something underlying going on. There's a problem. So you'll never be criticized for being cautious. You'll never be criticized for referring the patient for a second opinion. You will be criticized if you're cavalier and you'll go, don't worry about it. You've obviously just rushed into clinic. Don't worry about it. It's absolutely fine. So have a think about it. The conclusion of this whole process is hypertension is a global issue. It's massively undiagnosed. It's a huge burden on society, and the majority of patients walking around will not be aware that they have this underlying condition. Educate your patients. Think about lifestyle changes, nutritional advice, exercise. These are hugely important parts of the process. We're not just there to treat the patient for their MSK problem and then see you later. It's about a holistic approach, mind, body, and spirit, as we say in osteopathy, the three-legged stool. We are looking at that person from a biopsychosocial perspective. We're looking at giving them advice that will help their long-term health. Remember, note down your patient's blood pressure on the first appointment. Repeat it every 6 to 12 months. Any changes in their symptom, you can note it down. And remember, if in doubt, refer. Okay? Have a little look at the PDFs following this little video presentation, and you can have a look at and download the slides if you want. It's really important, guys, that we get across blood pressure testing should really be part of your new patient case history sheet. It's not difficult to do, but it's a really good way that we can start generally looking after our patients' overall general health.